What oral antibiotics are used for diverticulitis? Have you ever wondered what oral antibiotics are used for diverticulitis? This condition can cause discomfort and pain, especially during flare-ups. Understanding the treatment options is crucial for managing symptoms effectively. The primary oral antibiotics for treating diverticulitis, particularly during uncomplicated acute flare-ups, are designed to target specific bacteria involved in the infection. The first choice is amoxicillin-clavulanate, commonly known as co-amoxiclav. This antibiotic is usually prescribed at a dosage of 500 milligrams of amoxicillin and 1 to 5 milligrams of clavulanate 3 times daily for about 5 days. This combination is effective against a variety of bacteria, including Escherichia coli and Bacteroides species, which are often implicated in diverticulitis. For those who are allergic to penicillin or when amoxicillin-clavulanate is not suitable, there are alternative regimens available. One option is Cefalexin, a cephalosporin antibiotic, combined with metronidazole. Cefalexin is typically dosed at 500 milligrams 2 to 3 times daily, while metronidazole is given at 400 milligrams 3 times daily, both for 5 days. Another alternative includes trimethoprim combined with metronidazole. In this case, trimethoprim is dosed at 200 milligrams twice daily, alongside metronidazole at 400 milligrams 3 times daily for 5 days. Additionally, Ciprofloxacin combined with metronidazole is another option, especially if a patient is transitioning from intravenous ciprofloxacin under specialist advice. Ciprofloxacin is usually given at 500 milligrams twice daily, with metronidazole at 400 to 500 milligrams 3 times daily, often for a duration of 10 to 14 days in outpatient settings. These antibiotic combinations aim to cover both aerobic gram-negative rods and anaerobic bacteria, effectively managing the infection. In more severe cases that requiring hospitalization, intravenous antibiotics may be used initially, with a transition to oral antibiotics like ciprofloxacin and metronidazole once the patient can tolerate oral intake. The duration of oral antibiotic therapy generally ranges from 5 to 14 days, depending on the severity of the episode, the patient's immune status, and their clinical response. It's important to note that recent guidelines suggest that antibiotic treatment is primarily recommended for patients with complicated diverticulitis, significant symptoms, or risk factors such as comorbidities or immunosuppression. For mild, uncomplicated cases, some recent evidence questions the routine use of antibiotics, but this decision should always be personalized by healthcare professionals. In summary, the most commonly used oral antibiotics for diverticulitis include amoxicillin-clavulanate as the first choice, with alternatives like Cefalexin plus metronidazole, Trimethoprim plus metronidazole, and Ciprofloxacin plus metronidazole. Always consult a healthcare professional to determine the best treatment plan tailored to individual needs and circumstances.